yeah,
Now, what about disc herniations into the spinal canal? I think most disc herniations are going to be more IVF just based on the anterior to posterior nature of that, where the spinal
yeah.
canal is more anterior. How often do you see spinal canal herniations? And would this type of traction still help that?
They would, and I mean, you know this. One of the reasons why, because we have all the way in the very back of our spine, we have the posterior longitudinal ligament, which is like a thick piece of leather that goes
Yeah.
all the way down our spine, and that prevents that direct posterior disc herniation. But I do a fair amount of injury cases, car accidents, where when instability, where the bones are able to move forward and backward beyond their normal range of motion,
Yeah.
that can cause a little bit of elasticity or loosening of that posterior longitudinal ligament, where it actually allows a posterior disc herniation to go backwards towards the spinal canal. And it doesn't happen that often, but it just depends on the magnitude of injury and force. But when there's instability going forward and backwards, which you can see on flexion extension films, then you have to look for that also, which an MRI, of course, could show you that.
But
but
you
but
find you still are able to recover patients like that
yeah,
if
we
there's a
are. There's such an incredible power to traction, and it's so simple. But the key is really the frequency and the consistency of use.
yeah.
Like what we stress, what we found is that if you can use it for 21 consecutive days, 21 days, use it before you go to bed or when you wake up in the morning, whatever's most convenient for you. But if after 21 days, most of our patients are a lot better. If you're not, then you better go check in with an orthopedist because you might be a surgical candidate.
Yeah, and at what point do you need surgery? What are the signs or symptoms? What percent of people do you think you're able to save from getting surgery? Do you think 90, 95% you can avoid? And what symptoms do you have to look for when you're like, okay, yeah, you really need surgery, and then maybe we work on this later?
So, like for me, I'm a perfect example. I had an enormous disc herniation in my neck, and I was starting to get atrophy of my left tricep
Hmm.
and part of my pec. So, if you're getting atrophy of muscles, you need to consult with a surgeon because that can be a permanent issue. But
Hmm.
again, if you have numbness and tingling, if your reflexes or sensation are affected when you go in to see any healthcare provider and they evaluate you, and if those things are progressive, they're getting worse, or they just will not go away with any type of conservative treatment.
Even
um,
traction as well.
Even traction. I mean,
Yeah,
I wish we could help everybody. We can't, but our success rates are over 80%,
yeah.
and most studies show that about 80% of people that take on traction, they get better. But there is, I don't know the exact percentage of people that are just, always going to be surgical candidates or not. But, in my office, I have a great relationship with the orthopedist who actually did my surgery. So he's incredibly conservative. He knows all about chiropractic, traction, everything. If I get a really difficult case where my patient's just not progressing, I'll send him over to Nitin Bhatia, and he'll look at him. And many times he goes, you know what? Go back to Fisher. Keep doing it. Let's give it another month. Or let's give it
Yeah.
another month after that.
See how much you can retract that disc back in. And if you're seeing
Yeah.
seeing
Yeah.
improvement, and imagine some people, they probably still feel a little bit better on the traction if they have a disc issue. So if you see a little bit of improvement and you can inch away at that, like 21 days, you said, then you can probably get some momentum, I would assume.
Exactly. And that's the key. It's getting that therapeutic momentum of treatment over and over and over on a consistent basis.